All right, so we got a decent number of attendees in there. So we'll go ahead and get this kicked off. Welcome everybody to this afternoon's webinar on indoor environmental control. At Shadow Ventures, we continue to hear time and time again, especially in this world of COVID, the increasing importance of indoor air quality and control. And whether that's coming from owners, operators, or brokers, it continues to become an increasing priority for that entire group. So I'll stop talking, and it gives me great pleasure this afternoon to introduce a real expert on this space, a member of Shadow Ventures and the CEO of qlair, Ellie Amirnas.
Thank you, Brian. Appreciate the introduction. Good afternoon, good morning, everybody, wherever you are. I hope everybody's doing good, safe, and kind of happy in this situation right now. So without any further ado, I will start talking about what's going on and currently about the COVID-19 situation and how it's actually affecting everybody in the real estate environment in building management business. I will share my screen, and Brian, let me know when you can actually see my screen so I can get presenting.
Yeah, you're all good. We can see it perfectly.
So the purpose of the meeting today, or me basically talking a little bit today, is to go over some of the information that's coming out about proper environmental control after COVID-19, or also during this pandemic right now. I know that like everybody else, I also hear a lot about standard strategies, the way that this virus can get transmitted in different environments. There's a lot of information. It might be very overwhelming for everyone. So the purpose is really to actually go through it and see what's really out there, and how we can actually structure them, and what is the right strategy for your building and can help you to have peace of mind for yourself, and also whoever actually stepping in your building, either be your customer, your employees, your tenants. So that's basically the purpose of this project. Just a quick introduction of what qlair is and who qlair is. qlair is actually an indoor air quality monitoring solution, and we are a team of air quality experts that got together and helping the commercial buildings to actually manage the indoor environment safely, efficiently, and cost effectively. So the agenda for the presentation today, or the webinar, is why the indoor air quality is more important than ever. I think you guys have heard a lot of news, so I'm going to go through very briefly through some of them. And then we talk about how actually indoor air quality applies to the COVID-19. And what are the strategies that can reduce virus spread going forward. So the objective of this presentation is really to identify and understand the implication of the poor indoor air quality and inefficient environmental control, looking and discovering the ways that indoor air quality applies to the transmission and mortality rate of the COVID-19, and implement the strategies available to ensure that your building is safe, clean, and clean to reopen. I think you have heard a lot from different sources that one of the sources is EPA that actually make air quality and poor indoor air quality one of top 5 environmental danger for human health. By looking at the COVID-19 mortality rate, poor indoor air quality can actually affect drastically on that, also on the virus spread itself. And since we're spending, I mean, this is something that you might have been hearing all around, since we're spending most of our time indoors, the indoor air pollution can be 2 to 5 times higher than outside. I mean, a lot of people, when we talk to them, they say, like, well, we have the filtration in place, right? But there's a lot of other factors that can actually create and be the source of indoor air pollution. And that's why you see when you are in an enclosed or enclosed compartment or a space, the rate of, for example, infection can go higher. Instead, if you're outside in the outdoor, this is not the case. So it is very important to look at indoor air quality in a different way at this point, and considering that as important as is for your water to be clean, the drinking water, the air that you're breathing and putting in your body is also very important to be clean. So just taking a step back, I know it's been oh my God, it's really 3 or 3.5 months with a lot of information news coming in. We tried to kind of narrow them down and categorize them into the modes of transmission and prevention strategies, the ones that everybody are agreeing on in terms of like the sources and resources that are credible, like for example CDC, WHO, and also building standard like ASHRAE. So there's basically 3 modes of transmissions. One is the contact transmission, which is, most of you heard of it, surface contaminated by the droplets, or if somebody is infected already touching it, and high touch surfaces like tables, doors, handshake, like doorknobs and everything. And to prevent this surface disinfection and personal protection of washing hands and everything, and also improving cleaning schedules is the prevention strategy that they're talking about. And there's research that's talking about the percentage of each of these transmission mode, and then contact transmission is actually only 20% of this. Looking at the second mode of transmission is the respiratory transmission, which is basically direct in a closed distance. When somebody is in the same room, an enclosed area, and they're talking, and it's transmitted by big droplets that can very fast also fall to the ground. But the prevention strategy for this one is social distancing and personal protection equipments like face mask. So there's 40% chance of getting infected through the respiratory transmission. And the last but not the least, and I think you've been hearing some news recently from NY Times and Reuters, and that WHO is not admitting that it's airborne transmission, but there's about more than 200 scientists penned an open letter to WHO that they have to listen to all these research that's been going around, that this virus spread can be also airborne transmission. And based on a lot of research, actually 40% of the transmission mode can be from airborne transmission. That means really long distance transmission via micro droplets that can stay up in the air up to 30 minutes or longer. So this transmission mode is what we want to talk about on the prevention strategies, and how we can help to actually protect the customers, tenants, employees, everybody's actually standing in a crowded indoor area, how we can actually protect them. And this is the focus of this presentation. I want to bring 2 outbreak examples that was published at the very early stage of the COVID outbreak. One was a study or like a case study from restaurants in China, in looking at the air conditioning system and how it's actually designed, and the airflow, how the airflow is around the tables. As you see, the air conditioning system is blowing the air, and there is a return of that, and the exhaust fan is not working. So by looking at this, you see that the first person, who is like the patient A1, was the one that was infected originally, and then the rest of them actually got infected after the fact. So this shows how the airflow inside the building can affect, especially like in enclosed areas like restaurants, fitness centers, office spaces, how important it is to look into your ventilation setup and the ventilation settings. Another one case study is about a call center that was in Korea. And if you're looking at the confirmed cases, these blue deaths are the confirmed cases basically. And they had this area, which was pretty much open, and they had the same airflow study that they had, and you see how it can actually affect the whole area and infect the people. From here, I want to get to a point now and show you why the air quality is really important, and why we're looking at in general, not only a short distance air quality around the people, but in general air quality inside the complete building. So ASHRAE standard states that the transmission of the COVID-19 can be through the air, and it can be kind of airborne, and exposure to the virus should be controlled. So with that said, they are making some recommendation on changing the building operation regarding the HVAC system to reduce the risk of virus spread. I just wanted to make a disclaimer here that we are, I am not, and our team is not like, you know, a medical doctor. We are looking at the researches and bringing all of these together to put a procedure together to reduce the risk. So there is no such thing as zero risk at this point for that. Also, a study from Harvard University shows that the small increase in long-term exposure in particulate matter 2.5 micron or any fine dust particle can have large increase in the COVID-19 death rate, or also the infection. So with all that said, and as you might know, that there was a lot of, you know, information about what you have to do to actually take care of your building, and what are the operation settings that you need to change in your building. But before even I start talking about the strategies, I want to tell you why there are certain setups, like for example, you say 100% fresh air intake, HEPA filtration, filter class increased, you know, disinfection, all of these. Why are they talking about that? And there is a science behind it, and there is a reason that these strategies are set in place. There are three main things that actually increasing the chance of the virus spread and the survival of the virus in the building. One of the things is the particulate matter in your building. The viruses are pretty small, and when somebody coughs or sneeze or speak, these nuclei or water droplets that contain the virus can be in the air. And if these viruses are not in those water droplets, they can actually use the fine dust and the dirt inside the air, or contamination in the air, as a carrier to linger around the area. So knowing what the level of particulate matter of fine dust in your space is very important to make sure that your space is clean and there is a low chance of the virus getting spread and you know, staying around in the air so people can breathe it. The recommendation from Well Building Standard and also ASHRAE is to keep the level of the fine dust below 10 ppm in your space. Another indication of like, or another air quality parameters actually that they're talking about is carbon dioxide. There is a research in place. I think it's actually published in, I have to remember, and it was like a national NCBI. It mentioned the correlation between the carbon dioxide level and the chance of the virus spread. So imagine that if there is like a conference room, small conference room, and 4 people are sitting in there. You don't have enough fresh air coming in. You're recirculating the air basically. Those people are like breathing and rebreathing the air that was exhausted by somebody else's body in the same air. So CO2 level is really an indication of lack of clean and fresh air in the space. And the recommendation is to keep the CO2 level below 700 ppm. That can be an indication. It's like how much fresh air is coming in, and you diluting the particles, viruses, or anything that's exhausted by somebody else's body close to you. So this is the reason that you hear about, like, you know, increase your ventilation, bring outdoor air ventilation, because they want to dilute the air to reduce the amount of virus and the amount of air that people are breathing. Last but not the least is actually relative humidity. As you might have heard, that this virus especially is a lipid envelope. So that means that it can survive in lower humidity, lower than 30%, and in the cold weather. So it is very important to monitor your humidity and making sure that you're keeping it between 40 to 70%. You don't want to increase your humidity to a level that you start having mold problem. So that's why you need to make sure that you have it in the same, in a healthy level. So with all of these said, I want to walk you through the strategies to reopen safely that was mentioned by ASHRAE standard and many more standards for the building operation. The first one is building ventilation to provide, that is provided by heating and ventilation air conditioning systems. This is to reduce the airborne concentration of COVID-19 in risk of the transmission through the air. So outdoor air ventilation is very important, and the indication of that you have enough of that in your building is CO2 level. Mechanical filtration is to actually making sure that you are not introducing any outdoor air pollution to inside your space, especially for areas with, like, you know, wildfire or pollen problem or outdoor air quality problem. You want to make sure that you have clean air inside and you are not introducing any carrier for the COVID-19 or any virus inside the building. So that's why the improvement of the filter class for your air handling units is very important. Last but not the least one is the retrofit solutions. And for example, there's a lot of information and recommendation regarding the HEPA filters. A lot of air handling units might not be suitable to actually use HEPA filters. So a lot of people get HEPA filter air cleaners, UV lights, bipolar ionization, all of these to actually kill or capture the virus and bacteria, because they're very small and they seem to be very effective. So these are the three strategies, main strategies that are recommended by the ASHRAE. But it's not, I mean, this is until now, I'm basically repeating what information is out there for you guys. There's a lot of common concern, and I want you to ask yourself if this came to my mind, to your mind or not. When you hear about higher ventilation and put 100% fresh air inside, it can increase the energy consumption, especially for hot areas like Raleigh during the summer. Having the higher ventilation means that you have to cool the air all the time, so your utility bill can skyrocket, basically. So the question will come out like, how can we optimize with no compromise on safety? And this is a question that I would like to answer at the end of this presentation. Another one is that, what if I cannot increase outdoor ventilation or filtration efficiency in my space? What if I have a space that I don't have access to the ventilation setting and setup? It's the property owner or somebody else. Or I have a PTAC system. I don't even have access to the outdoor ventilation. Or what if my ventilation system cannot handle higher MERV ratings, like for example MERV 13, higher filter class, because they're tighter and it actually puts a lot of pressure on my air handling units. It can reduce the life expectancy of my fan and HVAC system. Is there any alternative? So this is also another question that we would like to answer. And the last one, but not the least, is the higher outdoor air ventilation loads your filter much faster. So then it means that your operational cost is going to go higher and your energy cost going to go higher as well. So how can we change the filter efficiently and safely? Because if you are putting 100% fresh air coming in instead of every 3 months, now you have to change it every month. Is it increasing the cost? Is it every month right? So this is also a question that I would like to answer at the end of this presentation. So as we mentioned, the main thing, and I think a lot of information that I talked about was, you know, there's a lot of recommendation coming from here and there, and main questions that coming from a lot of facility managers and business owners and building owners and property owners are like, how can I make a right decision? And this is the time to do it, because looking at the data will help you to actually make the right decision. So the first step that you want to do is really to identify the critical areas. This, and correct me if I'm wrong, but maybe in your daily businesses, you go in there and there are areas that nobody's actually in there, and you might not need tons of ventilation in there, or there's other areas that needs more ventilation. So how can you decide which area it needs more attention from you and more better air quality management rather than other areas? So the first step is to identify the critical areas, and the parameters, as we mentioned, that is related to COVID-19 to monitor is carbon dioxide, particulate matter, fine dust of particulate matter 2.5, 1 micron, 10 micron, and relative humidity. And then for those areas are the areas that you want to take action. So by looking at monitoring the CO2 level, making sure that it's less than 700 ppm, you can actually make sure that this area is safe. So one of the experiments that we did, or case studies that we did, is by looking at the CO2 level, you can actually identify when the building is crowded or which area of the building is crowded and need more ventilation. So not every corner of your building really needs 100% ventilation. And based on that, you can decide if you have over ventilation or under ventilation. As I said, we had a case study in a fitness center, which their ventilation system logic was 100% from 5 a.m. to 1 a.m. the next day. By looking at the CO2 level, we realized that they're over ventilating their space, and they can actually do that without any compromise on the air quality inside the building. They can have their ventilation set up for from 7 a.m. to 11 p.m. at night, and they could save $7,000 per year per air handling unit actually that they were using. So it's a great saving on the utility bill, especially in this situation that everybody's just like, yeah, make sure that you have 100% fresh air in, might not really be necessary. And you can just be wise about when the fresh air needs to come in and when it needs to stop. So as I said, I think I spoke a little bit ahead of myself, just looking at the studies that are going out there with the correlation between CO2 level and virus spread, is that if you are looking at the CO2 level, you can say that if this area is high risk or not. And it's pretty much easy to monitor it by looking at some indoor air quality monitors that are available, and we can also help you to source some of those out. Another monitoring or another air quality parameter that was important, and I think that's the most important one, is the fine dust, or the PM2.5. So based on the studies, and we're basically, there's so many of them, but we're kind of bolding the Harvard study here, that due to the COVID-19 exposure, the PM2.5 exposure, it can increase the chance of the virus spread and also increase the death rate. But if you can kind of identify the areas that have higher PM2.5 level, you can improve the filtration in that area, making sure that your outdoor pollution is not coming inside. You can make sure that you don't have any indoor pollution source or indoor PM level generator, for example, around printer, in the restaurants, for example, around the kitchen, and making sure that you're keeping the fine dust in your building lower than 10 microgram per cubic meter. But I think there was a question that we asked at the beginning, that what if I don't have the chance of, like, you know, filtering my outdoor air quality, diluting my air inside the building, or don't have access to the right ventilation system. So here's the answer to your question. You can actually use the retrofit solution. And what retrofit solution? It really depends on the area and space that you have. For the proper filtration of the particle in your building, I think there are a lot of air cleaners out there with the HEPA filtration units in space, and you can definitely use that. It's highly recommended also by ASHRAE standards and other building standards. There are, and I will introduce one of them, there are HEPA filtration units with the ultraviolets. These are the medical grade approved units that can actually be used around people, so you're not directly exposed to the UV light to have like a health hazard or something. So this can be used as a portable solution, and by using the air quality monitors, you can actually strategically place the air cleaners in the areas which needs high attention. I'm making an example of, like, you know, schools are getting pressure to actually reopen during the fall season. I went to school around here, and also there are areas and classes that they don't have ventilation. They have like these PTAC systems in place, you know, and there will be crowded. There will be people coming in, and then choosing the right air cleaner unit for that space. It is very important, and to make sure that you have the right capacity for that classroom, it is important to know what type of air or what is the air quality in the space, so you can basically adjust the number of units, the setting of the units. And it might sound very complicated, but I'm telling you, the system is already in place that you just have to buy it, plug it in, and it will be simple to use. So the recommendation here and the conclusion here is actually to use a HEPA filtration unit separate from your ventilation system, so you don't put a lot of pressure in there. And then if there is opportunity to use this HEPA filtration unit with the UV light, which is coming together, that's even better. So this is the solution that I wanted to introduce it to you. It's called TriClean. It has the 3-stage filtration. It's a MERV 8 pre-filter. It has a HEPA filtration in it, and it has a UV disinfection on the clean side of the HEPA filter. So if any viruses by any chance was, you know, could escape the HEPA filtration, it can actually be treated by the UV filter. The setting on this machine is in a way that it can change the air within 10 minutes on its highest flow rate, which is 500 CFM, and it's for a 500 square foot area. So you can actually, with a 10-foot ceiling, so you can actually calculate the number of air exchange inside the building. If you remember at the beginning, I said, like, the ventilation, this outdoor ventilation, everything is to make sure that you're diluting the air and changing the air inside your building regularly. The recommendation from CDC and ASHRAE for non-healthcare areas is 6 to 8 air exchanges per hour. So if you can do that with your air ventilation system, that's great. If there is no possibility to do that, you can actually clean your air and exchange your air completely with these devices. 10 minutes, 1 air exchange per 10 minutes, which is basically 6 air exchanges per hour. Okay, one last question. I was talking about the high outdoor air ventilation can load up the filter much faster, and that is correct. So when the question is when to change the filter, you know, when you're looking at this chart, if you have, for example, recirculation, you're looking at it as like it's not loading up that faster, but when you have like somehow 100% fresh air coming in, your filter can, especially in the pollen season or other like wildfire or other areas that have outdoor air pollution, your filter can load up much faster. So this can have two negative effects. One is that first of all, you don't know when exactly you have to change filter. It's just by looking at it. The second thing is can actually put some pressure on your fan because it needs to work harder to pull enough air from the outside as well. So the solution is really to look at the pressure drop in a systematic way from your air handling units and looking at when you can actually change the filter in the right time. It will save you a lot of time, a lot of money, as well as you don't have the hassle of like, you know, the disposal of the filter, is it right time or not. So with the case study that we had in a separate note, we could actually help the customer saving up to 15% on the operational cost. But again, this is something that you might have in place already. It is important to take a look at those data, or if you don't have that in place, more than welcome to reach out to us and we can help you with that. So the conclusion for this is really to make the right decision, or like, you know, a wise decision by looking at, by identifying the critical areas, you know, looking at the humidity, looking at the particles, looking at the carbon dioxide. And also, if you guys don't know if your building is getting cleaned in a regular basis, you can look at some of the VOC levels and see if that's getting regulated. But by analyzing those data, you can decide which one of these solutions really makes sense to have for your building. If you're a fitness center, you don't have exactly the same requirements that an office building is required, and you see that a lot of standards, building standards, just putting some very broad and generic recommendation that might overwhelm you. So the first step is really to identify the critical area and take the right step to treat the air and have a better air quality in your space. So as a conclusion, really, the steps to ensure that you have a safe reopening and safe keep opening, I guess, for your building and your business is to implement indoor air quality monitoring, to conduct analysis of indoor air quality trends and data, so it can help you decide on which strategy to pick. If you don't have the access to the right ventilation system, filtration system, introduce retrofit solutions like portable air cleaning machines. It's much less costly for you and your business. There are a lot of solutions out there, and we can also help you to find the right solution. And also monitoring the filter life cycle to ensure that you're providing clean air while maintaining the operation efficiency. So what a clean, safe, and efficient building look like is a building with reduced risk of COVID-19 spread, and a saving on the operation, 100% performance increased, either being an athletic center, a restaurant, or an office space, and making sure that your energy cost is not to the roof. That is it for today. So I'll be happy to take any question from you guys.
Awesome, thank you for that. If anybody has any questions, feel free to drop them in the Q&A or raise your hand and we can unmute you and put the spotlight on you.
I can also see.
Yeah, I can read them to you, or if you can see it, we got one question coming in from Harry. How hard is this to implement?
So it's actually a very plug and play solution. I mean, it's especially for the indoor air quality monitoring is a very easy user-friendly sensor that you place it in your area. And then you can have access to the information through a mobile app or a web portal. And for this specific solution that we provide, we also kind of work like a consultant with your team and provide monthly report for your team to make sure that everything is in place with the right recommendations. So one word answer to this question is one sentence, sorry. It's pretty easy to implement and install in the building. So for example, we had one building here in North Carolina that we installed about 20 sensors in there, and it took us half a day to do that. And the system or the facility manager themselves can do it as well.
Great, and looks like we got another question coming in. So not all air handling units can take the static pressure of HEPA filters. Multiple air purifiers are also not an option for larger buildings. So how can older buildings have air purification?
Yeah. So the HEPA filtration is really not for bringing outside air inside the building. So I totally agree with you that the use of HEPA filtration is for solutions, I mean, for example, for hospital areas and for areas that they want to recirculate the air through their air handling units. So I totally agree with you that a lot of air handling units cannot handle the static pressure of the HEPA filters. For older buildings, there are other solutions that you can actually put in place into like some retrofit solution in the air handling units, like something like bipolar ionization or UV. I mean, the UV needs to have a specific dwell time to be able to do something. This is a myth, for example, a lot of places going on. Just if you put a UV light in your air handling units, you're good to go. That is kind of not right, because the virus and the UV light needs a certain exposure time to be able to treat the virus or kill it. And by putting the UV light just at the air handling units, it might not be possible to treat the air. It can definitely treat the surface, but not treat the air. For the older building, really the answer is either using bipolar ionization on the air handling units, trying to have as much as fresh air inside to reduce the amount of virus per volume of the air, and that will be a solution. But I think the air purifier, especially in the closer area, or like, you know, like conference rooms or like places that is crowded and more people are sitting there, can be a right solution. Why not?
Great, a couple other questions coming in, so this is awesome. So can it be integrated into another system or no?
Yes, the air quality information can be transferred through what we call it, it's like a data package that we call it API, and it can be integrated into the building automation systems, or also if you have some system, there is just some development work that needs to be done with the two groups, but this is something that we have done before, and it can be broadcasted through other systems as well.
Awesome. And I think this is a follow-up question to that one. So is this system just for monitoring, or can it use AI to control the system? Example, AHU.
Yeah, air handling units. Sure, it can be. At this point of time, we didn't have any customer who actually did that. For being able to do that, we have to work with whatever system is actually controlling the air handling unit and create that control logic for that. Currently is mainly looking at the data and setting up the air handling unit schedule on the BMS system manually. But in case there is a request to do that, it needs to have like some development time on the control logic for the air handling units.
Awesome. Any other final questions? Holding just in case somebody's trying to rush out that last question. All right, perfect. Ellie, any final comments or statements you want to make before we go ahead and wrap up?
Well, not much. I think it was a great opportunity for us to actually talk with our audience and with your audience as well. Please feel free to reach out to us. You can get our information from Shadow Venture if you have any more question or need help. And everybody stay safe out there.
Awesome. Thank you so much for your time this afternoon. I appreciate it. And thank you everybody for joining.
Thanks. Bye.